What's going on, everybody? This is Spicy Topics, where you will hear heated celebrity topics, hot, and other topics. Make sure that if you do want to support the channel, you go ahead and do that. The information is here on the screen. Okay, anyway, just a brief update of what's going on recently with this coronavirus pandemic that has taken over. So I wanted to update y'all with Donald Trump. Donald Trump says to Cuomo wants all states to be treated the same, but all states aren't the same. Some are being hit hard by the Chinese virus. Some are being hit practically not at all. New York is a very big hotspot. West Virginia has thus far 0 cases. Andrew, keep politics out of it. He is referring to Andrew Coumo, who is the governor of New York City, who seems to be actually New York State, who seems to be very, very concerned about not only New York, but the entire United States. He believes that we should all be treated the same in order to combat this battle. People should be home, period. People should be home. 50% should be working at home. The United States will be powerfully supporting those industries like airlines and others that are particularly affected by the Chinese virus. We will be stronger than ever before. Mind you, there were many questions from reporters today in the briefing. Why are you calling it the Chinese virus? Do you realize that this is racist? Do you realize that people in the United States, even born in the United States that are Chinese, are being harassed and targeted? Do you realize that you're creating hate towards them, to these groups of people that are Chinese? President Trump responds to say the reason he's calling it the Chinese virus is because it came from China. He's saying that this is not racist, but what do y'all think about that? Do y'all think that this is racist for him to call it the Chinese virus? I mean, what if it was from Africa and he called it the African virus? Would it affect you in a way where you felt like you were being attacked? Well, certain groups are being attacked because of the way our leader is defining this illness. So here is what got Coumo started. Trump says, just had a very good teleconference with nation's governor, went very well. Coumo of New York has to do more. And he responds, I have to do more? No, you have to do something. You're supposed to be the president. And you can see that there's some unavailable message, perhaps deleted. Shout out to the Shade Room who posted this. You know, it is very disrespectful. It was said that they had a good meeting today and they finally, came under agreement. Coumo, the governor of New York State, and also President Trump. But you can see here that President Trump is being disrespectful, of course, when he says he has to do more. Like, you say something nice about the teleconference and then you end it to mean something that is kind of disrespectful and degrading. I've also heard I believe it was the mayor of San Francisco also say that it would be smart. People need to close down every state in the United States in order to defeat this virus. Close things down. People are still at work where I'm at. People are still in businesses. They're on the street, surrounding each other. They're not taking it serious. And it's crazy how when I look at what's going on in my state, I have to click here, then here, then here to find out that there's now 26 cases where it was just 16 cases. It's really just, I don't understand it. And you don't have your own live updates. We rely on another state in order to show our news and our live updates. That's just startled me. It just shows that because we are a smaller state, that the president is not really concerned. And even the people that own these companies where we work, they care more about money than they care about the health of the employees. On top of that, where I'm working at, people are calling in and we are in cold red because they're home and either irritated because they can't work and they have to stay with their family and they don't like to be home, and the fact that they are worried about their services. So we are having to stay at work. The least you can do is demand that people leave and work from home. I know it will be a hassle, but it's at a less of a risk of you catching something and sharing and giving it to somebody else who might react to the virus in a more severe way. You never know. This is a new pandemic that's taken over, and you might think it's not serious, but it is serious. For some, it's very serious. It's detrimental. I applaud Coumo for caring about other states in this country rather than just his own.
I'm doing policies jointly with New Jersey and Connecticut, and now we're bringing in Pennsylvania. Because none of these policies work unless you have a big enough geographic area. We just closed bars, for example. If you close the bars in New York, people will drive to New Jersey, or they'll drive to Connecticut. That actually makes the situation worse. So you need policies that are a big enough geographic area that they'll work, rather than people just move to the next suburb where they can stay with a friend or a family member. And that's very important. You say to New Yorkers, I'm a born and bred New York City, Queens boy. We're very good at getting around rules, Rachel. So if you say to me, well, if you're in Queens, you have to shelter in place, you can't leave, I'll go stay with my sister in Westchester.
It makes a lot of sense. What he's saying is, if the president is just issuing hot spots, one place that is very overpopulated, then what about the surrounding states? You close the bars in New York on St. Patrick's Day. What are people going to do? They're going to go to those other states that is around them, and they going to the bar. If they got the virus, they taking that with them, and they can be infecting people and making this whole population pandemic even worse, spreading this to other people. So I agree with Coumo, and I understand what he's saying. The policy that Trump is putting out does not work. And furthermore, I don't understand why they are suggesting or recommending it's time now for them to demand. Okay. Now, a lot of people, even some of y'all, think that this is not serious. We shouldn't take it serious. Black people, first they were saying black people can't get the virus. Okay. There has been black people that's been confirmed positive. There are other black people that are positive and don't know it yet. It takes about 5 days is the latest that these symptoms can show up, 2 to 14 days in some cases. So there are a lot of people that are positive and just don't know it because they don't have the testing or they don't have the symptoms yet. So imagine the many people they are around before they know they're infected with this virus. Like, it's serious. It's a virus. It doesn't matter if it's a acute virus or it's a bad virus where it's chronic. It is chronic to some people, and to some people they react differently. It just, you never know what it is. You never know. We don't know if it has long-term permanent effects where it can damage your respiratory system or any other part of your body. We just don't know. So people think that kids can't get it, but that's already debunked. At first they were saying that kids was the least likely to get it, or they would get it and they just didn't have the severity. But now the Hill is saying CDC analysis show coronavirus poses serious risk for younger people. Early data analyzed by the Centers for Disease Control and Prevention, CDC, shows that younger Americans are at substantial risk of experiencing serious medical problems from the corona sweeping the globe. Remember, you hear that? But they wasn't saying that earlier. They was saying that kids carry it, but they don't show that it's harmful to them. But now they're saying early data analyzed. The data runs counter to some of the early messaging from public health officials in other parts of the world. Okay, that makes more sense, or at least you're trying to make it make sense. A new CDC analysis of more than 2,400 cases of COVID-19 that have occurred in the United States in the last month shows that between 1 in 7 and 1 in 5 people between the ages of 20 and 44 in the sample of those who are confirmed cases require hospitalization, a level of significantly higher than the hospitalization rates for influenza. The true percentage of young people who require hospitalization is likely much less because many remain asymptomatic. Between 2% and 4% of confirmed cases among people that young are admitted to intensive care units. The fatality rate is low, only 0.1% to 0.2%. So as we hear, basically it is something that is affecting kids, and they are in the hospital in other parts of the country. You know, the thing about it is, to sum it up, is that we don't know, y'all, what this kind of thing can do in the long term. We don't know how every individual case will react to this virus. So I would think that the best measure to take is preventative measures, and that is the best solution. Stay in the damn house. Stay in the house. So the best policy is to refrain from going outside. Take it serious, even if you may think it's just like the flu. It's not. It is a coronavirus. It's different. It's something different. It specifically targets the respiratory system. You don't want to chance it. Everybody's going to respond to it differently, and we don't know. You can only pray and do the right thing. I think that, like Coumo said, that people should stay in. These businesses, they don't need to be greedy. I think that they need to really change how they're going about things. People need to work from home where they can. Surrounding states, need to also be in cahoots with it. Stop just caring about larger states that bring you economic benefit. There are smaller states with people that pay their taxes and their human lives, and they do matter. You need to demand more. Smaller states need live updates. We don't need to rely on other states to put our news out. We need news out. We need to know how many people affected, because I had to click, like I said, I had to click before I could even find out in my own area how many people are now positive. Just think about the people that are not tested and don't know they have it. I think it would the thing to do is to lock people down. People don't want that, because there's people, like I said, who don't want to stay in the house. They don't like it. Some people just don't feel like being around their family all day. Others have to make money outside of the house. That's understandable. Some would just rather avoid, they would rather avoid being in the house altogether. They just can't sit down and sit still, and it drives them crazy. But you got to think about what's safe. You should give people at least the option to stay home if they want to. And all else fails, demand it. So let me know what y'all think in the comments below.